As you can see here, this is one of my beautiful patients who I recently did an endoscopic brow lift as well as a septal rhinoplasty on, also known as a nose job. Starting with the brow, what you can kind of see is that preoperatively, her brow had started falling down her face and needed to be lifted. It was falling so much that she actually was shaving the tail of her brow and drawing it up higher. So what I did, through a bunch of small incisions in the scalp, I went in with a camera and released all the tissues and then stitched the brow up in a higher position. So now, as you can see in the after photo just 2 weeks later, her brow is already elevated and her eyes look more rejuvenated and youthful. When it comes to her nose, she had had a trauma to her nose several years ago, and the reason I did the rhinoplasty was not only cosmetic, but also because she had a lot of issues breathing. So as you can see from the bottom view of her nose before surgery, the left nostril was basically collapsed. So what I did during surgery was I reset the deviated septum in a position to create a more open airway. And on top of it, I went ahead and I refined the nasal tip and straightened out the dorsum to give her a more refined and aesthetically pleasing appearance.